Well, good morning, good afternoon, and good evening, social marketers from around the world. My name is Patrick Cook, and as president of the International Social Marketing Association, it's both my privilege and, as always, my privilege to introduce the 39th in a series of webinars designed to advance social marketing teaching, research, and practice. So I'm here today with ISMA's webinar manager, Christine Jennings. You see her there on your screen. And we also have a panel of social marketers eager to talk to you about the implications for social marketing in this time of COVID-19. We're going to get started in a minute, but before we do, we have a couple of announcements. I'm really pleased to present and let you all know that we have our new website up and running. It's at isocialmarketing.org. If you're using the old URL, that will also get you there. It's got a new look and feel. It's in responsive design. And you'll also see that there's some wonderful resources related to COVID-19. So we have many of the resources that our member associations have made available, as well as other information that is going to help you during this very odd and strange time. So for those of you who are joining us for your first time, welcome. We do bi-monthly webinars, and we have speakers and we talk about issues from around the world. We often offer these webinars jointly with our regional association. So be sure to check out our next webinar on June 10th, and we're doing that with the Social Marketing Association of North America. Registration is now open through the website, the one that I just talked about. So right now, I'm going to turn it over to my friend and colleague, Christine.
Thanks, Patrick, and welcome everyone. As we get ready to introduce today's panel, I want to encourage all of you to communicate with the webinar team using the chat box. If you have any technical questions, you'll see that box at the bottom of your Zoom screen. And Patrick, if you can forward the slide. You'll also notice a Q&A box at the bottom of your Zoom screen. And when you're interested in presenting or submitting questions to our expert panel, you'll want to use that Q&A box. We'll start today's webinar with some introductory thoughts from each panelist, and then we'll answer some of the questions that you submitted during registration. Because we've already received so many questions from you, we're going to prioritize answering the questions that you've submitted. And then with a little bit of time that we have remaining, we will take a couple of questions that you submit live at the end. The panelists have generously offered to provide written answers to any questions that we are unable to get to due to time limitations. So please make sure, if you have a question that you want to make sure that you get feedback on, that you use that Q&A box to answer that. So now I'm happy to introduce today's panel. We have with us Ross Gordon in Sydney, Australia, Sara Isaac in Orlando, Florida in the US, Gael O'Sullivan in Washington, DC in the US, and Mallory Peak in Spokane, Washington in the US. We're really fortunate to have these social marketers share their insights with us today. Each panelist, as I mentioned, has prepared a few introductory thoughts. So we'll hear from each of them, and then they'll answer the questions that you submitted in a few minutes. So with that, let's get started. We'll start first with Gael O'Sullivan. Gael has shaped social marketing projects addressing pandemic threats such as avian influenza. She's worked in more than 40 countries addressing global health challenges. She's a founding board member of the ISMA and is currently at Georgetown University's Business for Impact program in the US. Welcome, Gael.
Thank you, Christine. Patrick, if you could pull up my slides. Greetings to everybody around the world. I see some familiar names on the participant list, which is great. So I'm going to very quickly frame this discussion with some high-level concepts. I only have a few minutes and I have a lot I want to say. So I'm happy to answer questions at the end or after the session. The COVID-19 pandemic highlights the importance of public health and behavioral science approaches to contain and mitigate disease. In the absence of effective vaccines and treatments, the most powerful tools we have to prevent spread of COVID-19 and to reduce risk are voluntary behavior change measures at the individual level and social and cultural norm change at the societal level. Next slide, please. Let's acknowledge that behavior change is hard. Many people would prefer quick solutions such as medications or even surgery, as opposed to working every day to change their habits and lifestyles to improve health outcomes over time. Next slide. So what drives behavior at the individual level? Human beings are messy when it comes to processing information, assessing risk, and making behavioral health decisions. We use mental models or heuristics to sort through all kinds of data. And many of our behavioral health decisions are made unconsciously. We're constantly toggling back and forth between tensions along several dimensions, as you can see on this slide. Next slide. Norm change is also hard. At the community and societal level, it can take decades for norms to change. Often change is incremental, and eventually we come to a tipping point where all of a sudden collective public opinion has shifted and associated policies and laws create a new normal. Because of the COVID-19 crisis, we're being asked to do a lot of things differently, immediately, and to make these changes at scale. Nope. Can we go back to the social norm? There we go. Nope, still there, great. And adding to this challenge is the very confusing guidance and mixed messages we're receiving here in the US from our federal government, state and local governments, public health experts, and private businesses. The new behaviors we're supposed to adopt include wearing a mask in public, which most Americans have never done before. Next slide. We're also being asked to adapt previous cultural traditions, such as shaking hands, to adopt newer and safer behaviors, such as bumping elbows. Next slide. When possible, it's extremely effective to design visual and physical cues to specifically show people what they should be doing. Physical distancing at least 6 feet apart is a good example of this. And note that I use the term physical distancing. We really don't want people to be distancing socially. We need to support each other more than ever through this pandemic. And so the term we should be using is physical distancing. Next slide. So what drives social norms? While we like to think that we make our behavioral health decisions based on facts and logic, again, we're much more messy than that. And we tend to make these decisions as a function of perceived peer approval and other social benefits. A couple of terms here are particularly relevant for COVID-19. Descriptive norms refer to our observations of how people actually behave in our daily lives. Injunctive norms are your perceptions of how things ought to be, or your perceptions of what is or is not socially acceptable. So that concept reflects your own personal values. Next slide. A quick plug here for this book, which was written by my Georgetown colleague, Leslie Crutchfield. Leslie analyzed a number of social movements to identify common factors and best practices that help them get to that tipping point for broad social norm change. So if you want to learn more about this, I'd recommend Leslie's book. Next slide. So just a couple of last slides to bring us back to behavioral science theories and social marketing. There are many useful behavior change theories, models, and frameworks to inform our work, but there are a few that I find particularly relevant for COVID-19. The first is the extended parallel process model, often used in pandemics. Sorry, because this model breaks down, there we go. So this model breaks down how behavior change happens during a pandemic or emergency. There are two sets of factors that have to work together to cause behavior change. On one hand, an individual has to perceive the threat as severe and also has to feel that they are very much at risk personally. And on the other hand, the individual has to believe that there are effective response measures available and that they themselves can do something to reduce their risk. The socio-ecological framework helps you understand the spheres of influence that can impact an individual's health behavior and can inform a multi-channel strategy to ensure a holistic approach. There are many behavioral science principles from the broader literature that we see playing out with COVID-19. And in the interest of time, I'll just cite a couple of them. The Dunning-Kruger effect, for example, explains why your cousin Kenny is an instant expert on the pandemic. People often overestimate their level of knowledge and expertise on a particular topic, especially when it's new. Anchoring is really a way to manipulate expectations about what's normal when you pick an arbitrary endpoint and then debate or negotiate from there. We've seen our US president use this technique in trying to set as a so-called normal endpoint the prediction that 200,000 Americans would die from COVID-19, so that if in fact only 100,000 die, this will look like a success. Next slide. So how does all of this relate to social marketing? Social marketing offers many important concepts for the COVID-19 pandemic, and I'll just highlight a few. First, it reiterates the importance of understanding your audience and segmenting by different variables. A recent message test in the US showed, for example, that different messages worked in different geographic regions of our country to motivate people to change their behavior. Second, the 4Ps framework helps us think through different dimensions of the marketing mix that have to work together to drive change. And third, marketing and social marketing use exchange theory to consider how to frame the offer, whether it's a product, service, or behavior, in relation to perceived barriers and benefits. And lastly, we like to say that successful social marketing efforts make the desired behavior change fun, easy, and popular. Next slide. So I'll leave you with this last behavioral science principle that helps explain the seemingly irrational behavior of buying out all of the toilet paper in the store. Zero risk bias posits that we'd rather eliminate one category of risk, even if that puts us at greater risk overall. People are often inherently selfish in a threatening situation, and we also imitate each other's behavior. So once you see empty shelves, you want to stock up on toilet paper too. Next slide. We don't have time to show this video, but we'll send the link afterwards. It's a funny but also really serious piece that really brings to light all of the many confusing communication messages and behavior change messages that are out there trying to help with the pandemic response. And with that, thank you.
Thanks, Gail. Next is Sara Isaac. She's currently exploring the challenges and opportunities for behavior change as COVID-19 upends social norms and behavioral habits across the world, including its impact on climate action. Sara founded a climate action coalition that successfully pushed for a local commitment to 100% renewable energy, and her work was recently featured in a National Geographic documentary. She's a principal at Marketing for Change and my colleague in the US. Welcome, Sara.
Thank you so much, Christine. We can go ahead to the next slide. So as this amazing before and after picture in New Delhi shows, a key climate lesson from COVID-19 is that change is possible. We can, as a collective world, dramatically reduce emissions of greenhouse gases. Obviously, with a global economy that's primarily powered by fossil fuels, this is not sustainable, but it proves the havoc we are wreaking on our planet is a choice we are making. Go ahead, next slide. COVID-19 has forced us to take a planet break, but history tells us this is unlikely to continue. This graph of world energy consumption shows dips from previous economic downturns, including the 2008 global financial crisis. It shows how recovery led to even higher levels of fossil fuel consumption. Next slide. So as we think about how to incorporate climate action into conversation about rebuilding our economies, I hope we will do less of this. This is a beautiful award-winning ad, but I believe this often popular gloom and doom approach can inadvertently suppress climate action. First, it fails to build a sense of agency and self-efficacy. How can one person stop climate change? Second, It ignores present bias and ignores present bias. It places this risk far in the future when we're going to evolve into a fish head. So they are scary risks, but not urgent. And third, anytime you give people an overwhelming problem, but you do not give them the skills and tools to act, you can provoke the ostrich effect, which is simply the human bias to stick your head in the sand and pretend a problem doesn't exist. So next slide. What I love about Drawdown, both the book and this website, is that it provides evidence-based solutions for impactful climate action, but it is developed primarily for experts and perhaps a few very engaged climate activists. I consider myself pretty engaged. I've read it, but not to the depth that I should have. Next slide. So the question is, how can we fit climate solutions into the lives of ordinary people living through an extraordinary time, like these commuters returning to work in Milan last week? How do we make climate action relevant and salient for people trying to return to some sense of normalcy in a time of great uncertainty? So for the next slide, here are 4 key opportunities I see for climate action during this pandemic. First, it has never been more clear that we are all in this together, and climate change like COVID-19 is a global threat. Second, COVID-19 shows how much we are willing to do to protect personal and public health, and studies show that across the United States, people are also willing to protect the environment over the economy. But we need to make these health impacts of climate change more visible and more salient. Most people don't know about them. Third, for both COVID-19 and climate action, cities are often the locus of change. As a politician in my hometown likes to say, potholes are not Republican or Democrat. Policymakers who see community impacts up close are more likely to act. Fourth, in times of transition, people are more open to adopting new behaviors. If we act quickly, we can help promote and build on climate-friendly behaviors like cooking at home, recycling, composting, and conserving energy, which my agency's Parent Normal survey shows is increasing across the United States as families shelter in place. Next slide. But there are also key challenges to our ability to support climate action during the pandemic. First is pent-up demand. Flight reservations are already picking up as airlines relax cancellation restrictions and advertise deals. People are anxious to get back to normal, which will mean a normal energy consumption. Second, who gets the stimulus money? Governments across the globe are already thinking about unprecedented levels of economic stimulus packages, and fossil fuel heavy industries are likely to be the first in line like they were in 2008. Third, the global economic downturn may overshadow the urgency for climate action. And there was a question submitted about whether we should even be thinking about anything besides COVID right now. But I do think that climate change, as some people have called it, they say climate change is COVID-19 in slow motion. But that said, climate change may struggle to gain the attention of citizens and policymakers who are dealing with this incredible unknown. Next slide. So I'm going to wrap up with 4 ways I think we can use our social marketing skills to build back better, because we do need to build back, so we might as well build back better. First, it needs to be about now. Increasing urgency by showing how fossil fuel emissions and climate change are harming humans in the present. This is not about the future, it's about now. Second, make it about health. Climate change is already impacting health in many ways, and the link between air pollution and the risk of dying from COVID-19 is one example. Third, make it about community resiliency. Like I said, this is about building back better. It's about creating a better future rather than just preventing disaster. And lastly, I hope that social marketers can help redefine abundance. Climate action is often equated to asking people to give up things they love. And I don't think we can ask people to sacrifice more right now. But I do think we can redefine abundance in more eco-friendly ways. So next slide. Thank you so much. I look forward to your questions and comments, and over to you, Ross.
Great. Thanks, Sarah. Ross Gordon is up next. He's the president of the Australian Association of Social Marketing, and he drafted the association's COVID-19 statement. As professor at Queensland University of Technology, his work focuses on a range of social change issues. He's published over 80 academic journals, book chapters, conference papers, and so much more. He's also on the ISMA's board. Welcome, Ross.
Thank you. So I just wanted to really talk about three things today very quickly. First of all, just to share some thoughts on the apparent success of Australia in tackling COVID-19 so far. Second, a little bit about the personal impacts and the importance of mental health and well-being during this pandemic. And then third, really a reminder building on Sara's kind of comments there that other social problems are still important despite this pandemic going through. And really a clarion call for us to still be doing social marketing to tackle some of these other issues. Next slide, please. So I wanted to talk a bit about the personal effects of COVID-19, and I'm sure we're all experiencing these. It's been a crazy time. Certainly in our work lives, there's a lot of disruption. We're having to switch to moving online. We're having to, figure out our workflows in different ways. We're all worried potentially about what's going to happen in our workplaces and whether job losses and cuts will be made. We're all on Zoom all the time, and I don't know about some of you, but sometimes I feel really zoomed out. And, I even moved house with my wife recently during the COVID crisis. And, that was a very strange time and stressful time to move. Next slide. But really living in Australia, obviously we've had a good control of the crisis. The biggest effect for me, and I think for a lot of people, is on mental health and well-being. And, I've been experiencing a lot of stress and anxiety because of the people in that photograph. I'm originally, as you might be able to tell, from the UK. I'm from Scotland, and the United Kingdom has had one of the poorest responses to the COVID pandemic. You can see that the death toll has been, very high. There's been a lot of criticism of the government response to that. And, living in another country, you're worried about your family, you're worried about people back home. And I'm sure that we're all dealing with that. We're all worried about people who may have a health condition, who may be older, who may be living in a country that's, not handling the pandemic well. So if you're going to the next slide, I think that we know that mental health and well-being is really important, and that's something that the World Health Organization is talking about. We know that stress and anxiety is increasing, and they've provided this fact sheet on that. Here in Australia, the Australian government has invested quite a lot of resources into Head to Health COVID-19 support services and increased telehealth access to mental health and support services as well. Next slide, please. Then we turn to, okay, what's going on around the world in terms of tackling this crisis from a behavioural aspect. There's been a lot of interesting conversation around behaviour change, about social marketing and about nudge. Particularly we've seen in countries like the UK, nudge has kind of had some of its limitations become apparent, and there's been a lot of discussion about the herd immunity approach to the pandemic in the UK, and that nudge theory is a poor substitute for hard science in important issues like a pandemic. Next slide, please. However, that doesn't mean that nudge is irrelevant. And, as Gael showed, things like, markings on floors, having videos by, sort of famous people, or groups like the Wiggles, who are like a children's TV show here in Australia, reminding us how to wash our hands. These are, relevant nudges that we can use, but we do know we need to use other tools in the armory as well. Next slide, please. Can we have the next slide? That doesn't look right.
Sorry, Ross, I'm having a little issue with my computer here. There we are. We're back.
Right, I see. But social marketers have actually worked on pandemics before, and it's been interesting for me in Australia and watching around the world that social marketing hasn't been talked about more in tackling this crisis. Certainly here in Australia, people like Sandra Jones have done a lot of work on developing strategies, social marketing strategies around pandemics. And I think what I'd like to see in the future is social marketing being able to be more at the forefront of those conversations. The other thing that I want to talk about was social marketing during the pandemic. These other social issues that are still a major concern. We're actually seeing here in Australia an alarming rise in things like online gambling, which obviously has significant health and social impacts. Next slide. And you can see here, you think, well, things like gambling, they're not going to be important to people. But when people are stressed, they're worried about their income, and they're stuck at home a lot, they get bored, and they end up kind of moving to these kind of behaviours in an increasing way. And the gambling industry has been smart about this. They're still offering a punt, whether it's basketball in Tajikistan or betting on the weather. There are even bets available on which country is going to have the most infections. So, you know, betting is going on in a big way during this pandemic. Next slide. Another issue, in terms of the work that I do in this area, we're still trying to keep our social marketing projects running, whether that's switching to do research online, whether that's looking at media analysis of how gambling is changing during the pandemic, and also asking some of our participants to comment on that as well. And yes, we're using Zoom as a tool in that armory. Next slide. The other thing I wanted to talk about is energy use. That's, again, a major concern here in Australia. People, again, stuck at home more. They're using a lot more energy to work at home. And for poorer people in Australia, the high cost of energy is a real concern. So we've seen regulators, policymakers, and the energy retailers have to respond to that. And we are worried about the kind of longer term impacts on that as well. Next slide. So in that area, I've still been trying to continue work, things such as policy analysis, things such as running Zoom Delphi workshops with customer groups to actually try and make sure we're tracking what's going on in terms of the pandemic and energy consumption. Next slide, please. In terms of what next, here in Australia, I'm sure some of you might have seen that Australia seems to have handled the pandemic fairly well so far. And I think an important reason in that was early intervention. So Australia closed its borders to China back in late January, and also Australians repatriated from that country were quarantined offshore for 2 weeks. And there was a lot of controversy about that at the time, but I think what we're now realising is that prevented the virus getting into the country in big ways. But coming out of the pandemic, or coming out of this first wave of the pandemic, there's still a focus on things like closing borders, and there's a real need to work across sectors to try and move forward successfully. And that's where behaviour change experts need to be part of that picture of epidemiologists and healthcare, public health thinkers, infectious disease specialists and policymakers. And what I'd like to see, certainly here in Australia, but also globally, is that social marketers are really involved in those conversations. Thank you.
Great. Thanks so much, Ross. Appreciate your insights. On to our next panelist. Mallory Peak is a leading COVID-19 strategic communication efforts for private and public health clients. She brings her social marketing experience to discuss COVID-19's impact on issues such as substance abuse, violence prevention, and mental health. She is a senior account director at DH in the US. Welcome, Mallory.
Awesome. Thank you, Christine. So I'm based in Washington State, and with COVID-19, our state had some of the earliest cases in the US, and we had to respond quickly and independently. And our team at DH works with the Washington State Healthcare Authority, along with school districts, large hospital systems, but also tribal health departments across the Pacific Northwest. And today I want to share how to continue social marketing programs and address barriers and motivations in the process. Next slide, please. So right now, the theme underlying all of our work is simply, how do we support each other right now? And the biggest thing we can do in times of adversity is to make space for good things. Next slide, please. That means we're looking for opportunities to be helpful, to remove barriers, to go first with a solution to a problem, to share factual information, to lean into the role of trusted message carrier, to curate content based in research that's factual and accessible, and to promote empathy. So weaving empathy for what people are experiencing right now into all areas of programming and communication, anticipating not just barriers and motivations, but the struggle that many in our communities are facing, especially when it's hard. So I want to share just a few examples of how our team has tackled some challenging topics. Next slide. We oversee our state's opioid prevention campaign, and we know that in times of isolation, substance use can go up. A big focus is preventing misuse of prescription medications. So April 25th is National Take Back Day in the US, where people across the country return medication to designated take back sites. And last year, to give you an idea, our state collected over 9,000 pounds, 4,000 kilos of medication. And because of concerns about COVID, all events were canceled. So we had to pivot quickly. We revisited our strategy and looked at how we could help keep people safe. We promoted a locator tool to find permanent take-back sites that operate year-round. We asked for a commitment for people to block up medication as a prevention measure while we're staying at home. And we encourage protective behaviors through our community networks. So promoting healthy activities, self-care, and bringing a sense of community virtually. Next slide, please. As information nationally is politicized, as rumors circulate, we've seen a lot more pressure on local organizations to interpret basic information for their community. School districts especially have had a direct line to parents and caregivers and have been triaging information. So this is just the homepage of the Spokane School District's website. And the first thing that you see is a pop-up with the most sought after information, from school closures to laptop distributions to ways people can volunteer and help. And this is a simple thing, but leaning into that role as trusted message carrier, using that position to share factual information is so important, even if it's not your primary responsibility. Next slide, please. Our last big takeaway is promoting empathy at all levels, and working with a large children's hospital, they quickly noticed an increase in children with injuries, and the concern about child abuse in our country is really high. We also know that parents are facing significant economic and emotional stress of their own, and so we approach this topic with empathy. Next slide. We shared tips on managing stress. We encourage networks to do the same, and we needed to make space and acknowledge the pressure on parents right now, and that it's okay to reach out for help. And in all materials, we also included signs of abuse and emergency numbers, but leading with empathy, especially when it's hard, when stakes are high, is really critical. Next slide, please. So we're moving from an understanding that at the end of the day, we're all doing the best that we can with what we have. And moving from that place has really been key to addressing barriers and motivations effectively right now. So thank you.
Thanks so much, Mallory. And thanks to all of our panelists for your initial thoughts. In the second half of the webinar, we are going to take some time and answer some of the questions that all of the webinar participants have submitted at registration. I will tell you that we received a lot of questions, and we certainly don't have time to answer all of them in our hour-long webinar, but we're going to do our best to get to as many topics as possible. Also, the panelists have generously agreed to provide written answers to your questions that we're not able to get to live, so please make sure that if you have a question, use the Q&A box at the bottom of your Zoom box and submit your question there. Also, if you see other questions that you'd really like to have answered live, use a little thumbs up to upvote that question, and we'll try to save time to answer the top 1 or 2 questions that are upvoted. So keep your eye on that Q&A box. So panelists, let's start with some questions around messaging and engagement. So how can we get people to maintain distancing when at this point they're tired of it, they're struggling financially, and the threat doesn't feel as immediate. Many of you talked about that the power of immediacy for messaging. Any thoughts on that? Gail, you'll have to unmute.
Yeah, so the study I referred to in my slides was looking at what messages actually motivate people to act. And it was interesting, given how notoriously self-centered Americans tend to be in terms of our culture, and it's all about me, not we. It was the messages that spoke to people's higher desire to be a good citizen and protect the community that actually were more effective than the ones that were more self-interest oriented. So I just thought that was interesting.
Ross?
Yeah, I think that's a really important point. For a long time in behaviour change, we've got a bit too focused on what's in it for the person, you know, individually, and it's all been this kind of individualisation framing. Some of the research that I've done shows that people do actually care about societal value. They do actually care about the greater good, and that can be used as a leverage to perform pro-social behaviours. And I think we need to kind of focus more on that rather than just making this base assumption that everyone's selfish and kind of greedy and self-interested. The other thing I would say is that, you know, we need leadership on this. So I think in Australia, we have had that. We have had, you know, leaders and health experts and people practicing what they preach. Whereas, you know, if I look at the UK again, or certainly in America, you know, the leadership is just not there to do these things. You know, when you've got Trump going to a mask factory and then playing Live and Let Die and not wearing a mask, what message does that send to everyday Americans, to normal Americans about physical distancing? So we definitely need to set the tone at the top as well.
Thanks. Adding on to that point about masks, someone submitted a question, how do we get people to wear masks? So we talked earlier about the social marketing fun, easy, and popular. So some of the questions were, can we make it cool? Can we gamify it? Can we make it a fashion statement? Make it sexy, make it positive.
Well, we need supply. I mean, the thing about masks is people can't get them that easily. They're very, even in Australia, difficult to get. They're impossible to get in the UK because my family members, we had to post some to them. So I think in some parts of the world, they're really hard to get hold of. And the kind of make your own mask, I think people are a bit dubious about, is that really going to protect me? What does that really do? I think we've kind of fumbled the kind of messaging on masks. You know, first they weren't recommended, then they are. Then it's like, well, we need this certain quality of masks, and now it's, well, you can make your own mask. And I wouldn't have a lot of confidence if I'm an individual citizen about, you know, the messaging that we're getting about masks and the evidence behind that.
And I'd like to add to that. So in Florida, where I live, as has been noted before, that masks are not very common in the United States, and so people actually don't know how to wear a mask. So you see people with the mask here or the mask here, and they're almost like a talisman. I'm wearing a mask, so I don't have to worry about other things. And there is some concern about, then I'm not going to be more careful about washing my hands and doing the social distancing and other things. So this is actually one case where there is a major information deficit, but the information that comes out is too much. So we really need fun, easy, popular in terms of making it short and simple, and really just pictures, how to wear a mask, when to wear a mask. I see people wearing masks inside their cars because they think it's protecting them somehow. So that the misinformation has been a missed opportunity that leads a lot of social marketing for people to catch up.
Yes, it's good segue, Sarah. Speaking of misinformation, someone submitted a question. Social media is flooded with news about COVID-19, and yet there are still disbelievers. There's a lot of misinformation out there. Any other thoughts about how we can cut through the message clutter in a time of urgency when not only is there a lack of clarity about messages, but there's seemingly some intentional misinformation, disinformation? Gail? And I think you're on mute.
Sorry. Sorry about that. Yeah, I just heard today that Twitter is now going to ping you if you're looking at content that they've deemed to be inaccurate or misleading. So I think Facebook and Twitter and some of the purveyors of this kind of content are trying to step up their game and do better. But I also wanted to mention, I've seen some survey results by Porter Novelli, the PR and advertising firm. They've done 3 waves since this started in the US about public opinion. And what was really striking to me is in the latest wave that just came out last week, the public's trust in the federal government is at 14%. I mean, it's just plummeting super fast. And it speaks, I think, to this larger issue of, this is new. We don't know all the ins and outs of what works and how to prevent it. And the guidance does keep changing. And what a federal official says is not the same as what a local or state official says. And people are super confused. And so where do you go for that trusted source of information? We all know social media is rife with all the disinformation. In the US, our media markets have become so polarized politically that we don't have sort of that one common sort of BBC trusted, source that everybody can turn to get the same base of information. So I don't have an answer. I'm just adding to the layers of problems with this.
Thanks, Gail. Sara, and then Ross.
Just add on to it really quickly. For those of you who know the Yale program on climate change communications, they've been doing 6 Americas. They've been tracking public opinion polls around climate change for a number of years. And the dismissive is about 10%. And then they've seen the other 6 categories all the way up to alarmed growing. But that dismissive 10% is the one that has been well funded and with sophisticated partners driving the conversation on climate change. So interestingly, they pivoted to COVID for their last 2 studies. And when I saw the first study, it's like 10%. Don't believe in COVID. And there's a couple of reasons for that. It is who they are as a segment, it's the makeup of their psyche. They're also the people with the guns in the state capitals who are getting the most attention. But it also is because the same folks who are funding and fomenting climate denial are in the game of COVID denial for whatever reasons that I can't tell you. But what we do know, back to what Gail said, is trusted sources. If you look at who people trust information from, they do trust our healthcare providers, and that trust has gone up. They also tend to trust their local politicians. So if you are talking, if you're trying to convey important information about COVID, making sure that it comes from those trusted sources. Ross?
Yeah, I might speculate, Sara, on what you said, why that's happening. I think it's all about following the money and power. Ultimately, if you look at who the denialists are and who are the ones that are propagating misinformation, it's because they have capital interests in, businesses going back to work or in fossil fuel companies being, sort of supported. And really, I think it is a major concern. We are living in a post-truth world at the moment. You mentioned the BBC. Even the BBC is being heavily criticised in the UK for being biased and not having a reasoned balance of opinion. So, what's happening in the UK often is you might get a climate change denialist or a COVID denialist brought on as a balance to actually the more kind of truthful and scientifically based arguments. Social media certainly is, flooded with bots and trolls and flooded with paid for opinion. I think social marketers need to think carefully about the politics and the power and money behind all of this. It's getting much harder to actually cut through with truth on a lot of issues because the mainstream and social media are so influenced and so kind of affected by these concerns. How do we actually get truthful messages out to people and they actually are going to engage in that when, a lot of what we see in the media we can't trust very well?
So thanks, everybody. I want to take us in a slightly different direction. There was another question submitted about trust and building trust and the challenges of social marketing practitioners who are used to having face-to-face interactions with the people that they're serving and trying to help. And given the realities of what many of us are working from home, many of us don't have access. Any thoughts on how we can continue to do effective work when we can't rely on those face-to-face interactions, and also with some of the technological challenges that particularly many of our audiences, lower income, et cetera, face with technological challenges.
Oh, Christine, I can speak to that quite a bit. So one, around having effective engagement with your audience when you can't meet face to face. So a lot of our team has been working with community prevention coalitions around substance use and mental health in Washington State. We have about 80 coalitions, and a big concern with that group was how to maintain a connection to community when people are really vulnerable. And there are a few things that I think worked for us. One was leveraging social media platforms and letting people know that you're going to be putting information and activities there. And also thinking about activities that you can bring to virtual space, not necessarily just Zoom, but if there's something that you can, a worksheet that you could share across social media, if there's an ask that you can make, if there's sort of a mini campaign that people can participate in when they're bored. Even using things like the live feature, we've seen utilization of the live feature on Instagram and Facebook go up by like 50% right now. Mm-hmm. Using that to share a message of hope, to have Q&As with trusted community folks, and to have even just conversations around information that's spreading around the community. You can also, I think it's also an opportunity to show vulnerability and be real. You know, sort of how is your staff coping with COVID? How are your organization partners coping with COVID, with staying at home with the regulations in place? And then just two other things that I would plug is finding ways to partner with COVID service programs. I think that's really important for communities that may be more rural, that may be disconnected digitally. In our state, working with tribal communities, we've partnered with meal delivery programs, with health department care packages, with free lunch services to share information about health and safety. We've also partnered with essential services that are still open. So partners like grocery stores and pharmacies, even something simple like putting signage on routes to those places, really making an effort to meet people where they are. So building that effective engagement, it's really challenging. But one thing that is helpful is that we have a limited set of options, which can, in a strange way, make communications planning a bit more straightforward.
Thanks, Mallory. So for everyone, in just a couple minutes, we are going to have time for just a couple of questions, to take a couple of questions for you. So if you have questions, please make sure that you use the Q&A box, and then take a look at the questions that have already been submitted and upvote. We won't be able to get to all of them, but we'll do our best to get to the ones that have the most thumbs up. And then for those of you who joined late, our panelists will be providing written feedback to some of the questions we weren't able to answer live. Another sort of area that we haven't covered today, I think, is practitioners who are struggling to get their internal leadership on board with pivoting or doing new concepts or new ways of doing work under these current constraints, when there's, as you mentioned, sort of a limited bandwidth of staff who are pulled in many directions and have their own mental load. We talked about sort of external leadership and the need for political and et cetera leadership externally. Any thoughts on how to help folks who are looking internally within their organizations and companies to get support from their leadership for those efforts? Ross?
Yeah, I mean, I think what we need to do is just point out to internal leaders, you know, what our constituents are dealing with. You know, if we are working on an issue like energy poverty, or we're working on gambling or alcohol, whatever topic area it is, we need to demonstrate to internal leaders, you know, what our constituents are dealing with, what people in the community are dealing with, and that these problems are not going away or don't just pause and freeze in time during the pandemic. And actually, a lot of them are exacerbated. We look at issues like domestic violence, for example, you know, that's spiked massively across the world. You know, if you're working in an organization tackling domestic violence, there's just no moral and ethical justification to stop doing work or to not, you know, actually try and invest more. It is a concern. There is a lot of a kind of slash and burn approach at the moment in a lot of organisations globally, and worried about the kind of economic situation, when actually in a lot of these issues we need to kind of be investing more and thinking about, you know, the kind of models that will allow us to do that. I mean, I certainly, you know, in some countries it's better than others. Here in New South Wales, for example, the state government are investing quite a lot into other social issues and how they have been affected by COVID. But I know that that's not the case globally. So I think we have to just, you know, take it back to the people in the community who are really here to serve and talk and you know, demonstrate that what they are dealing with means that there's just no option, but we have to get this work done.
And a quick follow-on question to that, Ross, you talked about implications for issues that are, you know, substance abuse, violence prevention, et cetera. What about our friends who are working on social marketing programs that may not have the same level of urgency in the time of COVID, but this is the programs that they're committed to doing?
Yeah, I mean, look, that's an interesting question. You know, how do you make that judgment of what's a priority? You know, I think that's, you know, there needs to be good reflexive conversations within organisations, but again, also with community partners, stakeholders, and you know, citizens around that. You know, do people see that that's, you know, justified to perhaps pause something and switch to focus on another social problem or another issue that your organisation deals with? That has to be an inclusive conversation with all the stakeholders around the table. This is hard work. It's more engagement. It's more involvement. I think COVID has shown some of the limitations between doing everything digitally. There's no replacing that, you know, high touch, high involvement, high yards. And, you know, unfortunately, if you're worried about dollars, it's high cost. But sometimes that's the only way we can work. So I think it has to be based on critical and reflexive conversations within the round.
Great. I want to make sure we get time to answer, at least very quickly, panelists, our two most upvoted questions. The first is around sustaining preventative behaviors. So a lot of us are in areas where we're starting to reopen for business and go back to business as normal. And for those of you living in areas where that hasn't happened yet, it's coming soon. So any thoughts about how to sustain preventative behaviors over time as we start to transition through this pandemic, when these may interfere with income generating activities, and particularly in low income settings? Gail, and then Sara.
Yeah, well, I work mostly in the global south with very low income countries. It's been interesting to watch Africa, for example, which everybody was really expecting to just see numbers, you know, shoot right off the chart. And they actually, for the moment at least, thank goodness, are doing pretty well. But they also have more collective societies where people do have that true sense of community, and they really listen to elders, going back to this issue of trust. I would just say, again, social marketing and behavioral science offer lots of good ideas for how to sustain preventable behaviors, in the sense that we need to make it something that is viewed as a positive, not a negative. We need to reward people for doing the right things. I saw in the Q&A chat, somebody asked about shaming as a technique, which my personal opinion is never in my toolbox. I don't think you ever want to stigmatize and shame people. I would much rather use a carrot approach than a stick. But again, we have many examples from social marketing and behavioral science of exactly how to do that in this kind of a situation. So when these kinds of emergencies erupt, you know, one of my frustrations is I always feel like we don't take the time to pause and pull all of the lessons learned from either other pandemics or even more broadly, more social change, social marketing lessons that are totally relevant for what we're dealing with now. This is not the first time we've had to deal with these kinds of challenges. So I hope that we're going to dig down and pull out some of those best practices.
Great. And just as a plug, we have many of the social marketing associations have been compiling a lot of those resources that will be linked in this, that we'll share. We'll be sharing this on the ISMA website. Very quickly, because we're running out of time, Sara and then Ross.
Just really quickly, this is one place where those nudges, those visual cues are super important in a lot of places. They do just help people follow rules without thinking about it. And then the other is the norming piece. It's not a norm now to wear a mask. And building buy-in with the community leaders. If you want to go back to business, you need to keep the coronavirus down. And so what do leaders need to do with their own businesses? And more than anything, if we could just help people keep things simple. There's so much information. People are drowning information and crosswise information. And there's lots of studies that show that the more information you can, the less people feel that they've got the right reason to act. Make it simple, make it visual, make it consistent, and social marketers can do a lot to help with that.
Ross, quick thoughts, and then I'm going to squeeze in one last question.
I think this pandemic has illustrated a lot of problems in our social systems and forms of organising. And I think coming out of this crisis, we need to consider what matters more. Is it money and is it capital flows, or is it people and planet? And we don't have the balance right at the moment. And we need to address that. So that's a lot of these social issues we're talking about and dealing with them in the long term, they're related to the way that we organize our social systems.
I want to make sure we fit in. This is kind of a big question to save for the end. Craig's question, how have social marketers worked with media to help them set and shape public response, government communications, and policy during COVID-19? Ross?
We've been trying in Australia, and it's been really hard. It's been really hard to get cut through. The Australian government is very influenced by behavioural insights, like a nudge, and social marketers were more part of the picture about 10 years ago when the swine flu and bird flu were a concern. But in terms of media and policy, it has been very hard to get cut through on this issue. Australia has, I think, taken a more traditional epidemiological and medical driven approach, which has been quite successful. But in terms of the behaviour change stuff, maybe there were some things that could have been better. I think that globally as a social marketing community, we need to up our game in this. We are not getting enough cut through, and we're not getting those seats around the table with policymakers and with media to actually share what we can bring to help solve these kind of big issues.
Yeah, I'll add to that.
Sarah?
So I don't think much has been done on this issue. I know, for example, with gun violence, as we're quite known for here in America, that there was a sustained campaign to have media not report on the name of the shooter or do a long, they had to report the facts, but no more. And a lot of newspapers have adopted that. I think that's really important because many of the shooters are in it for the glory. So that's a place where it's success. I actually had my own personal attempt to influence my local media to get them to do something about mask wearing and then wearing on the chin and then carrying it around. And so they wrote a long story with no illustrations. There was no help at all. So there's definitely a lot we can do on that.
Very quickly, Gail, and you're on mute.
So one thing we're doing at Georgetown is we have a number of experts who are doing media interviews. They're some of the talking heads you see on CNN and MSNBC and Fox News, trying to get good, credible information out there. They are respected efforts in their field. They're trying to educate journalists as well while they're doing that. I think in the US, the government communications, to be honest, have been a complete disaster. The CDC has lost a lot of credibility all the way around in this. So I'm not expecting or relying on the government to come out with any great campaigns or messages. And, this also brings up Liz's question earlier in the Q&A about the new British campaign that has that bright yellow and green, almost like a warning construction road sign look to it. And the messages out of the UK now from the government are stay alert, control the virus, save lives. And a lot of us in this field feel like that's a complete waste of money. Those messages are not going to change anything. They don't tell people what they need to know, do, change to actually make a difference. So I think governments in general seem to have a long way to go on this.
Yeah, and the other 3 nations of the UK have rejected that actually. So it only applies to England, which creates more disharmony.
Well, thank you, everyone. I wish we had many more minutes, but I really appreciate our panelists. Thank you all, and for all of the participants in today's webinar. We are going to wrap up with just a final few slides. If you'll please stay with us for another moment or so. We would like to invite those of you who joined today's free webinar to become a member of the International Social Marketing Association. When you join ISMA, you also become a member of your regional association. You'll be part of a network of hundreds of social marketers and have access to a broader set of professional development materials, discounts to conferences, access to our webinar archive, which will include this one. And we also encourage you to visit the ISMA website for details on our June webinar. Registration is open now. Over to you, Patrick, to wrap us up.
Great. Thanks, Christine. And thank you very much to our panelists. It was a fascinating and wonderful discussion. And just quick apologies. I was the webinar driver here, and it's not my usual role on these, but there was a couple of glitches, so apologies for that. But thank you to Christine, who really was instrumental in pulling this together. It was a wonderfully informative and incredibly helpful webinar. So please do visit us, as Christine said, at the ISMA website, follow us on social media, and become a member. We'd love to have you join us. So this is the International Social Marketing Association. We now conclude today's webinar.